Hi, thanks for coming down and having this chat with me. I'm Karri from the Headache, Neck and Jaw Clinic in Brisbane. I'm a physio in the Australian Physiotherapy Association, and I've got a special focus on the pain interest group. But I'm here today with Dr Joshua Pate from University of Technology in Sydney, and I'm really interested in what you're finding out in your research, testing AI, and how it applies for pain specific. Please tell me more. How long have you been doing this AI research?
If we think about, like, in terms of the word AI, it's a big label, but if we think about chatbots, like most people would think of ChatGPT or something like that, and that came out, I think, November 2022. So it was probably about 3 years ago, so early 2023 when people started testing, it can write a sentence and it's a polished answer, but it's wrong and it's not clinically useful, and that kind of early versions. And then what we've seen, like right through to, say, February 2026 is agents that can do multiple steps, they can check themselves, they can go for minutes to hours at a time. There's it's kind of increased in capability, but also increased in risks. And so, our research team at UTS is really interested in trying to work out, how can this be useful, weighing up whether or not it's worth all the costs and risks.
Why does AI and associated tools need to be considered in healthcare?
I think the big push for me is the fact that people are already using it. And so we have some anecdotal data from clinicians where they're saying about half their patients have already consulted ChatGPT or Gemini or Claude before they get to the appointment or while they're on the waiting list. And so we've been doing some studies looking at kind of simulating questions, particularly about trickier topics. Like, say I do research in pain in children, and so a parent might think, the doctor's saying it's all in my kid's head. And then what we're doing is testing the chatbot to see, does it side with the guidelines, the child, the parent, the doctor? Like, when there's all these different people involved in a scenario, how does the kind of chatbot help? And I think, for me, why do we need to test it? It's because it's already happening. People are already using it. And I don't see it reducing, particularly when it cites resources and it can check blood work and all sorts of stuff. Because it can now make less mistakes every time it's responding, there's, I guess, a risk that we kind of will fall into believing it too much. But I don't see people veering away from it or stopping using it, because it's just going to become more and more capable. And so the allure will be that it appears more and more helpful. But I think the role of a clinician will still be very important, but it will be different.
I certainly see a lot of clients coming to me and they've already got a list of multiple diagnoses that have been given to them, from the extreme of it's just indigestion to you're about to have a cardiac arrest. And they're coming in with a lot of worry and fear. As a physio, how can we test the information they're being given? How can we also educate?
Yeah, it's almost like we've had health literacy and digital literacy. I think there's going to be this AI literacy. One way I've heard it, and what we're talking about in the session at APS, is calling it an electroceutical. So similar to a pharmaceutical, there's pros and cons. And us as physios, we're not prescribing medicines, but we're able to kind of consider them as part of our treatment. And so it's how does AI, in a similar way to medicines, also change things? Because it's affecting, it's not just information like Dr. Google. Dr. AI is more like advice, and it can change behaviors and it can change meaning. And so when they come and see you, the concern I have is that they come in and you're the second opinion. And I don't know, I don't think that will ever be a great idea. Whereas I think the reverse, if the system made no errors, then having it as a second opinion could be good, because you still get the therapeutic connection, you're building trust, all of the good stuff from a human to human interaction, but then you're also getting kind of like a safety net of a robot checking for you. But the thing that's challenging is with access. I do some research in rural areas and settings like that where there's long waiting lists or there's just no access. Again, there's just going to be this massive temptation, I suppose, to try and replace frontline care or first opinions with computers. And I think it needs to at least be tested, right? I don't want to go saying I'm pro AI or anti AI. I think my point here is just we need to be checking this. And it's not like we have any time either. The companies are making so much money and rolling it out, and they've got so much investment. that to keep up with it is almost impossible. And for research to keep up with it is even harder because there's all these time lags in getting ethics and all that kind of stuff.
And it is hard to keep up to date. So thank you for what you're doing. Yeah. I'm also seeing there is a huge amount of AI content now being generated as potential resources for people who are wanting advice and help on their pain. And yet people are having so many different layers of need to combat some of the stigma that is associated with pain information and understanding the general population. How can we as physios be improving the content that's out there, or how can we be ensuring it's getting the right message to the right people at the right time?
Yeah, I don't have an optimistic answer here. I don't know the exact pie chart, but imagine if like 90% of all information ever written was human generated at a certain point, maybe a couple of years ago. And maybe that's down to like 60% or something. Apparently, within a very short time, months to years, we're going to be at like 0.01% of all information in comparison to the AI. It gets called AI slop online. Okay. And so the idea is it's just regurgitating stuff that mishmashes of information, and it's not a primary source. Like, it is generating new words in new combinations, but it's very much just like, it's not actual information necessarily. And so that's this risk, like, and it's a risk for like authors with books, but it's also a risk for clinicians and it's a risk for patients. And yeah, I think the hardest thing is to try and to navigate it. I think there will be tools developed that will kind of assist, like specific tools. And so I know there's some companies out there who are building like scribes. Mm-hmm. So in an appointment, the AI is taking the notes. It's helping write the reports. It's helping draft things. But I think the important thing is to keep the human in the driver's seat. So they're ultimately responsible. So if there's an error in the notes, I think it should be the human's responsibility to take responsibility for whatever's generated as an accurate record. And like, I think it'll happen in low stakes meetings before it happens in clinical appointments. But yeah, we're already seeing it. Like, it's not like it's a possibility in the future. I think there's companies that are doing this and it's a challenge. Like, the efficiency gain is huge. And so there's a risk there. What could be done by 10 admin or office staff will just be automated. And then it's like, well, what do they do now? And so there'll be this redistribution of roles is kind of being predicted. And this is like thinking 5 or more years down the track. It's really hard to know where things are heading. Just recently, like, some of the AI labs are releasing new tools and versions that are so capable that they're not able to then release them. So that's kind of this new period where we're like, well, we don't know what to do about that either. But I think from the off-the-shelf, like, chatbots that are out there, my main tip would be to not use the fast, free versions because it's trained on that data and it has a lot more hallucinations. If you're going to use it, at least ask for like clickable links or something so that you can check it. Because again, it should be up to you as the clinician to make sure it's the correct information.
Well, I like the sound of saving time, but I am also aware that as the health professional, I am accountable for what I'm providing to clients. I want to go back to your research in especially the use of chatbots with the pain questions coming from children. And you were showing over time that these chatbot responses were becoming more useful.
Yeah.
How do we measure usefulness?
Yeah. So basically, we've got a panel of people together to try and think what would be the ideal answer. And they've done this, like medical doctors have done this, and even a couple of years ago, the earlier ChatGPT versions had more empathy in a written version than doctors. And that was kind of outrageous at the time. But now I look at the latest versions and I'm like, of course, like, it's so polished. And the way that it writes now, if you give it some decent prompts, it's very, very impressive. So what we were interested in is like, okay, this tech's gonna keep improving. Let's focus on how humans interact with this. Like, we can't keep up with the pace of change. So how does a human navigate when an AI generates the plan or the diagnosis or the blah, blah, whatever it is? And I think, the big question for us was stigma, because a lot of people with pain, like 20% of Australia, it's invisible. And so they're often, don't know the best term, it's like bottling it up. They don't want to burden other people. Everyone has good intentions. The support network around them wants to help, but it's invisible. And then the people themselves, it's challenging. And so they don't want to annoy people. And so it creates this culture of generally a lot of people aren't speaking up about it. And it's like, well, now you can have infinite access to this chatbot system. And so I think that's also driving a lot of interactions. And we see, like, in a pediatric pain clinic, I just heard a story recently where the teenagers' goal, that when they got asked, what's the goal with treatment? I just want mum to stop using AI. And so, because, like, I think as a worried family member, what's my child going through? What's my spouse going through? Whatever. They're wanting to know. And if you ask Dr. Google, it's sometimes good, sometimes not, mostly not. Whereas now these AI chatbots are very, very, like, skilled at writing long form answers that sound amazing. And then people are kind of getting in these echo chambers and rabbit holes of their own doing. So I think one of the skill sets for a clinician moving forward, like if we think about physios hearing this, it would be, how do we navigate an AI-informed appointment or an AI-informed family? And I think it's about, like, when someone, say you're prescribing exercises and they're not doing it, a strengths-based approach is to empower them and to get the family involved and stuff. And it's the same sort of thing here. I think getting the loved ones and the people who care also into appointments maybe, or at least reading the handouts and stuff like that, so that everyone's more on the same page. Because I think there's going to be more and more divisiveness where people are just doubling down and hearing what they want to hear, I suppose is a rude-ish way of saying it, but like if everyone's kind of hearing their own version of the story, there's going to be bigger clashes and misunderstandings. And then the physio will feel, well, I don't even, like, nothing I can say is even going to affect them because the partner's saying that and the kid's doing that. Or yeah, so that I guess that's kind of a little glimpse into what we've been doing. So from the research point of view, we've done like a bunch of simulations. We started off actually, because these chatbots aren't restricted by age yet, and they hopefully will be, but we said, I'm a child with chronic pain, is it all in my head? And this is a very, very hard, stigmatizing, kind of dark question. And the chatbots on our made-up usefulness scale were getting like 2s to 6s out of 10 a couple of years ago. And then by last year, like 8s. And then now we had to make a new scoring system because everything was a 10. And particularly if you give the tool, you say, hey, this is how I'm going to judge your response. It's very good then. And so I guess this speaks to this idea. It gets called context engineering or prompt engineering, where you say, hey, this is what I'm looking for. Like, I want it this way. I want these things in your answer. It'll then be able to do that.
Prompt engineering, that's what I'm quite interested in as well. Yeah. Because as a clinician, we can then be framing our use of AI to have that better, my perspective, quality control with better inputs. Yeah. But we can also then be potentially educating the family and the interactions of their use of AI. Yeah. So if there are any guidelines about how to ensure good input, my wondering is, will that improve the output?
Yeah, I think absolutely. Like, I think even just we're doing work in schools and education about pain there, and it's a similar sort of feeling of like, I think kids are gonna, like, critical thinking is gonna become such a big skill set. I don't know what it will be in replace of. Maybe memory, like you won't have to remember as much anymore because you'll just on tap be able to access not only information, but information with meaning, like advice versions of information. So when someone says, I've got a sore back, should I be moving? Like, it's not just going to say the guideline says blah, blah, blah. It's going to give you, based on your previous interactions, and if you're an engineer, it'll give you a mechanical explanation. Or, like, so there's all these things that just aren't in the training data yet of how important, say, underlying metaphors that people live by are. So yeah, there's so many considerations that I'm like, oh, guys, I wish it could just pause. And the leading experts are saying, even if the AI development paused now, we would still be figuring this out, like the rollout, for probably more than a decade. Wow. But the thing is, since they said that, say, 6 months ago, it's already improved again. And so, yeah, there's this real challenging feeling of like, how do I keep up? And so I've been writing a Substack, like a blog about, like, here's the latest things that have come out. Here's how to make sense of it in health. And that's been my way of trying to stay up to date. And I mean, doing research on it is also helping. But yeah, I think it really does require people carving out a bit of time, even just to kind of play and trial what's possible. Like, you can now, say for a patient, generate a personalized like kind of gamified app. If instead of giving someone 3 sets of 10 of something, it could be some sort of game, and instead of they tick a chart on their fridge, it's like rewarding them in the way that they like, and it's using behavioral nudges, and it's personalized to them, and then the information automatically comes back to you as the clinician. And like, there's so much potential for good here. And so I think there's this challenge of like, it's worth staying up to date to know more of the benefits and more of the risks. And I think we want people more informed so that they can kind of make better clinical decisions if possible.
When we're interacting with what I think you've termed as a highly read and informed intern AI level, but the physio or health professional is accountable, how can we navigate the security and safety issues of privacy, confidentiality, using informed consent with this space?
I think it's just so important, and again, the freely available off-the-shelf chatbots that are out there are training on that data. Like, we really definitely don't want anyone's personal information going into those systems. I think making up vignettes that are maybe similar to a generic case is fine to kind of test the waters, but there's lots of systems being developed that are keeping it private and kind of local. And I think that's where the promise is in terms of privacy. In the same way that we used to put someone's medical notes in a filing cabinet, or we'd store it in a cloud system, it'll be very similar. But yeah, I think it is really important to definitely to get informed consent. Even just like a lot of meetings these days, people have their own little AI listening and stuff. And so I wonder if people are going to get to the point where we just go, oh, well, everything's always being recorded, or not. But certainly in the short term, I think we should be really clearly saying, hey, there's a robot listening to help me take notes, or it's helping us to check if there's anything that we miss. I want to be really thorough. And I think just being really clear about your intentions as the clinician, and then giving an opportunity for them to explain their intentions, like that's the informed part of informed consent. But yeah, in terms of the data storage and some of the challenges of confidentiality, and even textbooks and things like that, which are getting kind of input into these systems, it's really hard, and I don't know what will actually change things. Like, they've trained on all of Google Books and all of these systems, and you're just kind of like, well, how? Like, will people sue these companies? Or like, I just don't understand how it's going to play out. But yeah, I hope that being thoughtful about it now means we don't wait until a crisis before developing better policies and procedures. And so, for instance, if all the physios around the world kind of thought together about something on a particular policy, like, we could develop that in advance before, rather than waiting until there's a nightmare privacy scenario that's happened that triggers helpful change. Like, I think we need to try and, if we can, think in advance of what we've got. And in that sense, like, the rollout, it's early days in some regards. It's not 100% of people using these systems. Nearly everyone can access it in Australia, but not everyone is already doing that, and they're doing it to varying extents. So yeah, I think there is an opportunity for us to be a little bit forward thinking, and it'd be great if there were clearer to guidelines and things. And I'm certainly involved in lots of discussions, but it's very hard to predict, like, by the time the guidelines written, the system's updated. Yeah. So I don't know, it's not a very optimistic answer, is it?
Well, it's something that we need to continue to work in this space, and that's where we appreciate your attempts to be staying up to date and checking with the input and output conundrums. Hopefully, as a profession, we can be informing some of the regulation and the use of these devices. And be informed as best we can. Well, thanks so much, Josh. It's been really interesting hearing where things are up to and where it's still going in this AI space. We look forward to hearing your speech tomorrow at the APS conference. Thanks again for your time.
Thank you for having me.